Can you recognize this as being brain tissue, central nervous system tissue, and specifically cerebellum tissue? Of course you can, because you can see this nice layer of granular cells, the periphery of which are these huge Purkinje cells, so typical of cerebellum, and which makes them so recognizable instantly. Here are the Purkinje cells, 1, 2, 3, 4, 5, 6, 7, and here are the granular cells. They don't look terribly abnormal, but if you take an area where you can see some meninges, perhaps here in this cleft, you will notice that there are some very well-defined granulomas. And the granulomas do not have any necrosis. They do not have any caseous necrosis, and therefore they are not caseating granulomas, but they are granulomas that have large giant cells, a lot of epithelioid histiocytes, some of them coalescing to form giant cells, and a lot of lymphocytes at the periphery of the epithelioid cells and the multinucleated giant cells. In all honesty, the correct diagnosis for this case would be non-caseating granulomas of cerebellum. Well, that could be literally due to anything. Could it be TB? Could it be fungal diseases? Could it be foreign bodies? Could it be certain viruses? Of course it could be. But the classical and most common thing that you think of when you hear non-caseating granulomas anywhere in the body is sarcoidosis. And sometimes it's kind of an exclusion diagnosis. Perhaps you can take some of this material and culture it if it was a biopsy. And if all the cultures were negative, you might say, well, they're non-caseating granulomas and they're not due to any culturable organisms. Often that is the most strongly suspicious thing that you have to make you think of sarcoidosis. And once again, it shows that granuloma of sarcoidosis could not only involve lung and soft tissues and upper respiratory tract, but it can also involve a brain and cerebellum, can't it? Of course it can, because that's exactly what we're seeing here in this case. Thank you very much.